Hey everyone, I'm Dr. Tony Dang, and I'm here today to talk about how I assess knee pain. And I'm here to have Tanya help us with that. So the first thing we really look at here is her posture, right? So we look at it from a front view. You can see if there's differences between her right and left side. So I like to look at the musculature of her thighs between left and right, all the way down to the difference in her calves, right? And from there, I want to take a look at what the knees are doing. Is she sitting in a position where they're hyperextended, so fully straightened out? And now I like to take a side view, and from here we're going to take a look at where the knees are sitting, right? Is she sitting in hyperextension, meaning the knees are just kind of fully locked out on both sides? And from there we also like to take a look at the shin angle, where her lower leg is sitting in relation to her ankle. If it's a little bit more forward, it's going to be different, and if she's a little bit more far back, that's going to be a little different. So she likes to sit on her heels if it's far back. If she's more forward, she likes to sit on the ball of her feet. And depending on that, it tells us a lot about where she's putting the weight in her lower body, right? So now we're going to take a look from the posterior side. You're going to get a better look at her hamstrings here and also her calves. And from there, we can see if there's any differences between the two sides. And also from here, we can see where her waistline is sitting, right? So if their waists are off-centered, it's going to tell us a lot about how she's placing the weight in her lower body. And in this position, we want to take a look at whether she has the ability for her back of her knee to touch the table, right? So if I can slide my hand through on one side and I can't on the other, it's going to tell us a lot about where her range of motion is. And depending on what her deficits are, we can construct a plan to take care of what's bothering her and hopefully get rid of the knee pain.